Hello, good people. Welcome to First Class Nurse. So today's presentation is about acute kidney injury. So in my presentation, I've subdivided into 6 parts. So the first part, I'll define what is acute kidney injury. The second part is about the causes. The third part is about the stages. Fourth part is about signs and symptoms. The fifth part is about nursing interventions. And finally, the sixth part is about the treatment of acute kidney injury. So let's start with the first part by defining what is acute kidney injury. So acute kidney injury, it is the sudden decrease in renal function that will lead to the buildup of waste in the blood, fluid overload, and electrolyte imbalances. It is also important to note in acute kidney injury, it can be reversible when noticed early and the cause treated appropriately. Secondly, let's talk about the causes of acute kidney injury. So we have 3 different causes of acute kidney injury, which are based on location. So we have pre-renal causes which occur before the kidney, intrarenal causes which occur in the kidney, and post-renal causes which occur after the kidney. So first, let's start with the pre-renal causes or pre-renal injury. This is an issue with decreased perfusion to the kidneys that can be caused by 1. Acute myocardial infarction, 2. Massive bleeding, 3. Dehydration, and 4. We have burns. And in cases of decreased perfusion to the kidney, this will lead to decreased kidney function. Secondly, let's talk about the intrarenal causes, and this is due to damage to the nephrons of the kidney that can be caused by 1. Injury to the kidneys, 2. Infection such as glomerulonephritis, 3. Nephrotoxic drugs such as NSAIDs, aminoglycosides, antibiotics, or chemotherapy drugs. Thirdly, we have post-renal causes, and this is due to a blockage located in the urinary tract after the kidney that can extend to the urethra. So the blockage can be caused by renal calculi or enlarged prostate. And in cases of blockage, this will prevent urine from draining out of the kidneys, which will lead to buildup of pressure and waste in the kidney and decreases their function. Thirdly, we want to talk about the stages of acute kidney injury. So in the stages, apart from talking about the stages, we'll also talk about the nursing intervention, signs and symptoms, and also treatment of acute kidney injury. So let's start. In stages, we have 4 stages of acute kidney injury. 1, we have insertion stage, 2, oliguric stage, 3, diuresis stage, and 4, recovery stage. So let's start with the insertion stage. So this stage starts when a cause creates an injury to the kidney, and then signs and symptoms start to appear. So insertion stage tend to last a few hours to several days. Secondly, let's talk about the oliguric stage. In oliguric stage, the patient will have the urine output will be less than 400 mils per day. Reason? This is because of decreased glomerular filtration rate. Other signs and symptoms you'll notice in oliguric stage patient, the patient will have edema, complain of skin itching, and also the patient may be confused and have acousmal breathing. So nursing intervention in oliguric stage, the nurse should restrict potassium-rich foods. The reason for restricting potassium-rich foods, we want to prevent hyperkalemia. The nurse should also monitor blood pressure, restrict fluid intake, daily weighing of the patient, and advise the patient on eating low protein diet. This stage, I'm talking about the oliguric stage, tend to last a week to 2 weeks. So treatment for oliguric stage is dialysis. So in dialysis, this is where the blood will be filtered through a special machine that will act as the nephron to remove excessive waste, water, and electrolytes from the body. So thirdly, we talk about the diuresis stage. As the name suggests, the patient will be voiding out an excessive amount of urine, about 3 to 6 liters per day. And this is due to osmotic diuresis, which occurs from high amount of urea in the newly filtered filtrate. So this stage, I'm talking about the diuresis stage, tend to last a week to 3 weeks. So nursing intervention in diuresis stage, the nurse should monitor for signs and symptoms of dehydration, and also daily weighing of the patient. Finally, let's talk about the fourth stage and the final stage. We have recovery stage. So recovery stage starts when GFR returns to normal and the kidneys start to function normally. So the recovery stage can last a year or more, and it depends on the amount of damage done to the kidney and also the patient's age. Unfortunately, it's important to note, some patients are unable to progress to the recovery stage or phase and instead develop chronic kidney disease. I hope you have enjoyed our presentation for today. Let's meet next time. In our next presentation, we'll talk about chronic kidney disease, CKD in short. Thank you. Have a good day.